Welcome to Raaonline. I am Dr. Sukanya. Now we are going to discuss about hepatic encephalopathy. So the flow of presentation is going to be, we are going to discuss the definition, the grading, pathogenesis in this part, and we'll discuss clinical features, diagnosis and management in second presentation. What do you understand by hepatic encephalopathy? So hepatic encephalopathy, it is a spectrum of potentially reversible neuropsychiatric abnormalities. So remember, it is potentially reversible neuropsychiatric abnormalities which are seen in patients with liver dysfunction with or without portosystemic shunting. So it is neuropsychiatric abnormalities seen in liver dysfunction patient which is potentially reversible with treatment. Okay, and what is the importance is overt hepatic encephalopathy develops in around 30 to 40% of patients with cirrhosis, and minimal hepatic encephalopathy, we'll see what it is in a few more slides. So minimal hepatic encephalopathy is seen in as high as 80% of patients with cirrhosis. So that is the importance. It's very commonly encountered in patients with chronic liver disease. So we need to understand what is the mechanism and what are the treatment aspects of hepatic encephalopathy. Now coming to categorization and grading. So how do you categorize hepatic encephalopathy? There are four major bases on which hepatic encephalopathy is categorized. So based on the underlying disease, based on the severity of clinical manifestations, based on the time course, and according to the presence or absence of precipitating factors. So we'll see each one by one. Now based on the underlying disease, so it is classified into type A, type B and type C. So what is type A hepatic encephalopathy? It is hepatic encephalopathy which is occurring in the setting of acute liver failure. Okay, so A for A. Type A is the hepatic encephalopathy occurring in acute liver failure. And what is type B? Again B for B. Type B is that hepatic encephalopathy which occurs in patients with portosystemic bypass. Okay, surgical shunts. In these patients, they can develop hepatic encephalopathy. So that is type B hepatic encephalopathy. So what is type C hepatic encephalopathy? This is what we commonly encounter in our clinical practice. So type C is hepatic encephalopathy which occurs in the setting of cirrhosis with portal hypertension. Okay, so type A is that which occurs in acute liver failure, type B in bypass, that is portosystemic surgery, shunts, bypass, and type C in cirrhosis. Okay, so this is classification based on the underlying disease pathology. Now categorization grading based on the severity of manifestation. So you have two major criteria which you have to understand. Westhaven criteria and ISHEN, that is International Society for Hepatic Encephalopathy and Nitrogen Metabolism criteria. So we'll just see what it is. So Westhaven's criteria, it's commonly we use Westhaven's criteria. So here you have 4 grades plus minimal hepatic encephalopathy. So what you understand from minimal hepatic encephalopathy is the patient is normal. That is clinically you cannot diagnose hepatic encephalopathy. There is no mental change. There is no clinical evidence of any mental change. But with some psychometric test, you can assess these patients and you identify them to have minimal hepatic encephalopathy. Okay, so they are abnormal results only with the psychometric test. Clinically, they are normal. So these patients come under the category of minimal hepatic encephalopathy. Now, what is grade 1 hepatic encephalopathy? In these patients, they have trivial lack of awareness. Very important symptom that they have is altered sleep pattern. That is, they can have insomnia, hypersomnia or altered sleep-wake cycle. Inversion of the sleep pattern may be seen. This is a common symptom and these patients may have anxiety or euphoria and they may have a short attention span. So, suggested operative criteria is these patients are oriented to time and place but they have minimal behavioral or cognitive decay. Okay, simple calculations, computations may be difficult in these patients but they are oriented to time and space. These patients are classified under grade 1 hepatic encephalopathy as per Westhaven's criteria. Now, what is grade 2 hepatic encephalopathy? So, here the patients, very important is they are disoriented to time. Okay, they are disoriented to time. They may be lethargic, apathetic, inappropriate behavior, and very important is clinical sign is they may have asterixis or flapping tremor. We'll just see what it is. So, asterixis or flapping tremor will be seen. Okay. So, this is grade 2, and here the operational criteria is disorientation to time. Okay. And what is grade 3 hepatic? Here the patient is semi-stuporous, there is gross disorientation, he has some bizarre behavior, is confused, but he can be awake, like he is responsive to stimuli. He is stuporous, but he responds to stimuli. So, here there is gross disorientation for time and space. So, just disorientation for time comes under grade 2. For both time and space, and patient is semi-stuporous, comes under grade 3 hepatic encephalopathy. And what is grade 4? Here the patient is comatose, he does not respond to even painful stimuli. So, we classify them as having grade 4 hepatic encephalopathy as per West-Avens. Now, what is this ISHEN criteria? That is International Society of Hepatic Encephalopathy and Nitrogen Metabolism criteria. Here, they have only 2 classifications, covert and overt hepatic encephalopathy. Minimal hepatic encephalopathy and grade 1 of West-Avens comes under covert encephalopathy, and grade 2, 3 and 4 of West-Avens is classified under overt hepatic encephalopathy. So, this is you have to understand the grading of hepatic encephalopathy based on the clinical diagnosis, clinical examination. Now, we have the third categorization based on the time course. So, hepatic encephalopathy can be episodic, or it can be recurrent, or it can be persistent. Okay. So, recurrent, what do you mean by recurrent hepatic encephalopathy is there is bouts of hepatic encephalopathy which occur within a time interval of 6 months or less. Recurrent episodes occur. Persistent means the person has a persistent behavioral alteration, is always present. He is little drowsy, he is little apathetic, he has some behavioral alteration always, he is not into normal mentation, and there will be interspersed episodes of overt or acute hepatic encephalopathy in these individuals. That is called persistent hepatic encephalopathy. Now, according to the presence or absence of precipitating factors, again you can have hepatic encephalopathy which is not precipitated or which is precipitated. So, in all hepatic encephalopathy patient, you have to identify or you have to look for precipitating factors, and these precipitating factors should be always addressed and treated for improvement of the patient. Okay. So, this is how you categorize hepatic encephalopathy. Okay.